Okay, so we've got some feet that have come in here with some apex calluses and corns. So you can see this one's really, really painful right on the tip of the toe. You can see how hard that is when I'm trying to pull the scalpel through it. It really just sort of slips off the top. So you have to be a bit careful not to pull too hard on these ones, because they can feel like you're tearing the skin if you pull too hard. So we're obviously using the smaller blade on this one. So this is the 15 blade, and it's just getting through that hard section is the hardest bit. And you can see right in the bottom there, you can see two little corns, or the cone-shaped ends of two little corns. And with these ones, you have to be a bit careful, because the underlying anatomy is there's a pointy bone right under there, and that's what's actually causing the corn, when the pointy phalanx end actually pushes pressure on the ground when you grip with your toes. So we go in there and remove all that callus, and then we should be able maybe to shave these right out. I'm not sure what we're going to do yet. We're going to have to go in there with the tip and get some of that out. So we're just going to have to go and get some of that central section out with the tip of the scalpel, because we haven't quite got it by the looks. We'll have a look. So we use the rubbing alcohol so we can actually see through the skin and see what is viable tissue and non-viable tissue. So we obviously want to go and cut away all the non-viable or the dead tissue, not the living tissue, otherwise it'll be painful and it will bleed. So you can see we've got most of that. You can actually feel in there, and sometimes you can feel there's a little bit of corn remaining. So that's why we use a combination of what you can see and what you can feel. And then there's also the consideration on these types of corns and calluses. If we take it all out in one go, it can be a little bit painful. So we've done this one before. So this patient can usually take getting most of it out in one go rather than just removing a little by little. So we'll go and get that. So the top corn's gone now. It looks like it's still there, but that's actually a hole that's remaining after the corn's been removed. We'll just, again, have another look at it after we rub the alcohol in it and have a look at it. And so we'll go and sand that up, put some moisturiser on it, and then try and deflect the pressure from this patient's apex of the toe so they don't grow back as quickly.